Cataract surgery in the presence of vitreous opacities, such as in vitreous hemorrhage or endophthalmitis, is often combined with pars plana vitrectomy. Even so, the cataract surgery is often very challenging due to the absence of the red reflex. In this video, we demonstrate several retroillumination techniques using either a 25-gauge chandelier or a light pipe to optimize visualization during these difficult cataract cases. Let's first look at two different configurations for the 25-gauge chandelier. First, we will demonstrate the view that is achieved by directing the chandelier down toward the vitreous. The patient in this segment has dense vitreous hemorrhage from diabetic retinopathy. Note the position of the chandelier as it is directed down toward the vitreous. Also note that the view is often improved by switching the microscope and room lights off and depending solely on the retroillumination. Next, we will demonstrate the view that is achieved by directing the chandelier horizontally or towards the lens. Here is a later segment from the same patient's surgery. Note the new position of the chandelier as it is directed horizontally towards the lens. This retroillumination technique provides crisp detail of the lens structures and provides optimal visualization during nuclear and cortical removal. One major advantage of using the chandelier as opposed to the light pipe for retroillumination is that the surgeon can use both hands throughout the duration of the cataract surgery. Because the surgeon does not have to worry about maintaining the positioning of the light source, he or she can focus on the difficult cataract surgery at hand. In this next segment, we will demonstrate the use of a light pipe for retroillumination in another patient with dense vitreous hemorrhage from diabetic retinopathy. Note again in this short segment the optimal visualization that's achieved with the microscope and room lights off. One major advantage of using a light pipe as opposed to a chandelier for retroillumination is that an experienced surgeon has real-time control of the positioning of his light source at all times throughout the cataract surgery. The obvious disadvantage of using a light pipe is that the surgeon must perform the surgery single-handed as long as he or she plans to maintain the retroillumination. In this segment, we see that the surgeon has removed the light pipe in order to free his second hand, allowing him to perform his primary horizontal chop maneuver. Following removal of the nucleus, the surgeon is able to withdraw the second instrument and reinsert the light pipe to achieve better visualization of the remaining cortex. As we have shown in these two patients with no red reflex due to dense vitreous hemorrhage, the chandelier and the light pipe are both great options for achieving retroillumination and optimal visualization during these otherwise very difficult cataract surgeries. But what about other vitreous pathologies that prevent an adequate red reflex for cataract surgery? In this final segment, we will demonstrate the use of the light pipe for retroillumination of the lens during cataract surgery for a patient with active endophthalmitis. This surgeon has chosen to insert the light pipe into the trocar to retroilluminate the lens during the capsulorhexis. The surgeon then uses the light pipe through the side port in order to illuminate the lens during phacoemulsification. These retroillumination techniques can be used to conquer cataract surgery with all different types of vitreous opacities. Thanks for watching.